America has been doing terribly for the past 45 years, given our love affair with mass incarceration.
The United States has a unique system of imprisoning the most disenfranchised people in our communities.
It really started with the war on drugs under Nixon, but we also saw a rise in the number of women who were being incarcerated.
So many women who get locked up are there for nonviolent offenses.
My name's Purple.
My name is Goldie. My name is Red, and I'm originally from Kansas City, Kansas.
The Kansas City community needs a lot of help, and I think that one of those things is providing services to those who have histories of incarceration.
They're there as a result of their drug addictions or their mental health problems.
I have schizophrenia. I had a bit of a mental breakdown. Came home to be with my family and got diagnosed and kind of started dealing with that.
I have anxiety and stress all the time.
The majority of women who find themselves incarcerated have histories of abuse, and those histories of abuse often manifest themselves in substance use disorders.
Death was the reason for my addiction, and I suffered in silence for years. I've been worldly all my life. You know what I'm saying? My flesh is weak to the drugs, to the street life. I mean, that's all I know.
The women in this population hold a lot on their shoulders. They are mothers without a lot of additional community and social support.
Unfortunately, because of my incarceration, I missed out on a chunk of their toddler stage.
I wasn't gonna let her be in the foster care, because a baby girl in foster care is no blessings. I got molested, I got raped because they know I was already touched all the time. So, I didn't want my baby to have to go through that.
The critical piece is to facilitate conversations with women about what makes sense in their lives. So for example, given your homelessness or given your active drug use, what are the strategies you use to get into regular medical care? We are the Sexual Health Empowerment Team. We call ourselves the SHE Team. And our mission is to empower people leaving the criminal legal system with health information, health resources, and help people brainstorm the skills and strategies needed to navigate health resources and health in general once they return to the community.
We delivered an education for 5 days, and upon their release, we've followed them around in the community to see how their practices have changed.
We got in there, we started talking about the woman's body and, different type of stuff. So as they started coming more, I began to learn a little bit more each week, so I continued to, grow with them over the years.
Not everyone has the exact same path, and sometimes those paths include trauma and drug use and anger and incarceration.
Sometimes when you're out here and you're active in an addiction, or you're just out in the world, you're not worried about some of the things like going to get a pap smear and stuff like that, but they're making you aware of what could happen, and that was stuff that I didn't know at that time, so it was very helpful.
You just felt it, because it was like you were talking to them in a way you would want to be talked to. Like when I had questions about sex, how would I want somebody to talk to me? It goes beyond just being research. We actually have relationships with the women. We get close to them, and I think that makes for better programming for women that have histories of trauma, criminal justice. That's what sets us apart.
I love them because they bold. They got strong hearts, you know what I'm saying? They brought us what we needed out there, condoms and hygiene. It's been a blessing. It's been a real blessing.
So if you do qualitative research and do interviews with women, long-form interviews, open-ended questions, you give women an opportunity to tell their stories. But when you follow women into their context, you're able to collect much richer data about how people truly live.
She met me on my turf. She came to the hood, to where I was. I followed them, they followed me when I came out of jail, and we kept on seeing each other.
Asking people to tell their story is acknowledging that they have a story. They're not just a number. These women are whole people. They've got flaws, they've run into problems, but they're also beautiful human beings. Embrace people when they come out of jail and provide for their health care and their housing and those sorts of things until they can get on their feet.
We really care for them, and we're really trying to understand them so that we can make policymakers understand, and people in the community that offer services. We want them to understand.
This ain't the life we're supposed to be living. We deserve better.
Can we engage policymakers in sort of reaching them with documentary film to say, here's our shared humanity, now let's have a conversation about what social policies really matter.
We can talk about sexual health. We can talk about incarceration. We can talk about those that exchange sex for money. We can talk about homelessness, and we can destigmatize all of these things by hearing the real life stories that the women go through.
We actually can make a difference in the community. Why can't we be a place that is a model for policy? And I think there are pockets in Kansas City where some of that stuff is happening. The potential for playing a role in that is really exciting.